warm welcome back for those who are back, and I hope some others will come. This second part will be on the part of access, equity, systems. We had some really interesting input this morning, and now I think we will look up questions of scaling up, of access for different groups, of gendered medicine. So I am very pleased to chair this part, and we also have the great opportunity to have, first of all, two keynote inputs from two women who really know what they're talking about. The first speaker will be Svetlana Stefanet. How to introduce her? I would say Svetlana is a member of the family because she is a pure-blooded public health person. From her studies to her work, and she's also teaching, has been teaching public health, but now she is working with UNICEF and is working here in Geneva, but has been to Uzbekistan. She is a real expert in immunization, and it is good for us to have her give us the UNICEF input, given the fact that UNICEF has done so much on the topic of immunization. Svetlana, I would like to invite you to give your input from the UNICEF side.
Thank you for this opportunity to be here with you and to share our experience and to share with you some challenges that countries are facing and some way forwards and how we collectively can improve the situation. And I will go through some evidence what we are and then we'll see what are the main challenges. So data from 2017, because all data are based from joint WHO-UNICEF joint reporting form, so data for 2018 are not yet uploaded in the system. It will be end of July this year. So, but looking at the evidence, the global coverage with DTP3 is suboptimal. It's at 85%, and it's not enough to protect children. There are three regions that are above 90%, and that is global target. And this is America, Europe, and the Western Pacific. But for Europe region, the target is 95, but it's not yet achieved. There are countries lower than 80%, lower than 50% of coverage, that 4% of countries globally have less than 50% of coverage of DTP3. And you see some 11% of countries having less below 80% of coverage, which is not optimal to protect children. And because of this, we have in many countries diphtheria outbreaks. However, we achieved during the last decade a lot of improvement and achievements and we saved a lot of lives of children because of immunization. In 2017, the more ever number of children have been vaccinated and less unvaccinated. Additional countries achieved maternal and newborn tetanus elimination. Not yet all countries that are at risk achieve this, but we are moving in improving situation. 113 countries introduced new vaccines since 2010. A huge improvement and achievements in the area of polio. And polio eradication showed really good results, but still we have 3 endemic with wild polio virus in our globally. that is Afghanistan, Pakistan, and Nigeria. The number of polio decreased dramatically, but still we have them. And in 2017, we had 22 cases. We have, because there are data available for 2018, we had 33 cases, and from the beginning of this year, we have already 22 cases of polio. A lot of efforts have been done to narrow equity gap in many health services, including immunization. And we managed to narrow a little bit, but not enough. You've seen that the discrepancies between high-income countries and low-income countries is still huge. We discussed, and we had a lot of discussion this morning about measles outbreak, proving that immunization coverage is not optimal, and there are pockets of population that are not vaccinated. From the beginning of this year, 170 countries registered measles cases, and there are already from the beginning of this year more than 112,000 cases. And comparing with 2018, the same period, when we had only 28,000. So it's 300% increase of number of cases globally. In this region, because I'm in this region, from this region, Ukraine has the most cases, and I think half of the global cases are from Ukraine. Because the coverage is not optimal for first dose and for second dose. It's we still, and we can see here the countries with lowest vaccination coverage, and with which is in red, that it's below 50%, but also we have coverage below 80%. And globally, it's first dose is 85 and second dose 67. Not enough to protect children. Recent Lancet article mentioned, based on the assessment of the measles cases globally, that most of cases in the past 5 years have been due to failure of immunization program. And much to be done to access those who are not vaccinated. Still, there are almost 20 million infants not immunized with DTP3, almost half of them in African countries, but also in Eastern Mediterranean and Southeast Asian region, quite a huge number of unvaccinated children. Top 10 countries with the most or under or unvaccinated. And you see in yellow, there are number of children unvaccinated, and in green, those who are under-vaccinated, meaning that they didn't receive full doses of vaccines, DTP vaccines. There are new vaccines available, and we discussed this morning. There are even for Ebola vaccines, for many other diseases, meningitis, malaria, but for main killer of children like pneumonia and rotavirus vaccines. But not all countries introduce their vaccines, these vaccines in the schedule, and those countries are not protecting their children from main killers that in the structure of child mortality, pneumonia, and diarrhea in many countries are the main killers. So, also about HPV, only 1 out of 5 15 years olds live in countries which introduce HPV vaccine. Who are and where are the children that are not vaccinated? Many of them are in conflict areas, remote rural areas, urban settings. A lot of people now moving from rural area to urban area, and in the urban slums, and there are many challenges to cover them and to vaccinate and to protect from diseases. 1 in 6 children in 2016 were living in conflict areas. 16% of globally, 16% of children are affected by conflict situations. And 8 million out of 19.9 million that are not vaccinated or under-vaccinated live in a fragile or conflict settings. That it's a complex situation that affect their health and well-being, and complex situation to make them vaccinated because there is a damaged infrastructure, disruption of supply, and poor vaccine management, the difficulty to retrain health workers in such settings. Delivery is unsecure. There are cases when vaccinators were killed. There is mistrust between authorities and communities, and a lot of population is moving around. Urban settings have its own challenges, a lot of mobility around among population, complex governance to cover with services and weak social protection services to support this population. It's, the disease has spread very quickly in this in urban poor area, in these neighborhoods, and there is a need for diverse stakeholders because the only health system cannot deal with the health and well-being of this population. There is a need for complex support from different social services. Remote areas have their own challenges, and the marginal cost to reach population is too high. Also, motivation and attention of health workers is a problem because no many health workers would like to work in these settings. Keeping vaccines potent and ensuring that they are available in these settings in rural and very remote area, it's sometimes very problematic because it's lack of electricity, but also lack of proper supply chain. These rural and remote communities don't have enough power to influence decisions. And also, very often data are not available because very often these communities are even not integrated in information system, and sometimes they are not taken into consideration when planning for health services. Also, there are gender-related challenges, not because there are no big differences between coverage between men and girls and boys, but because some gender issue influence the immunization coverage. Very often in some countries, mothers don't have enough authority or power or decision power to influence the decision of her decision or decision of children related to health services. They are very busy at their homework. They don't have transport to go to health facilities. They don't have enough knowledge and information, and sometimes they experience poor service quality that may influence their decision to go again and to come back to the services. Middle-income countries having more and more challenges related to immunization. In our region, 70% of unimmunized children are from middle-income countries. Globally, and I think Gavi estimated that by 2030, globally, 70% of unvaccinated children who live in middle-income countries. They are facing diverse challenges, not because they don't have, they don't influence, they don't support or don't finance health services, but they have competing priorities to ensure that immunization services are fully financed and properly financed. They sometimes there is weak political will to support immunization, again, because they have other priorities. Difficulty to access affordable prices, because for them, price for vaccines are higher than for low income countries. Often national coverage masks inequities, and there are subnational level suboptimal coverage below 80% because of equity. You see here in the picture is a Roma population, a Roma family. They don't know about immunization, they don't have access, they are discriminated. So in many of middle-income countries, there are pockets of population that don't have appropriate access to health services. And vaccine hesitancy that we discussed this morning also is a big issue in middle-income countries. Middle-income countries, they didn't manage to introduce new vaccine because, again, affordable prices. Vaccine hesitancy I will not discuss much because we discussed this morning, but it's an important issue and it's not a single solution to address it. WHO doing an assessment of hesitancy come up with three main issues like confidence, convenience, 3 Cs, and complacency. So all these factors influence the decision of parents to vaccinate their children, but we have to listen to them and to try to address the issues based on their issue, their causes. And we did in our region assessment of hesitancy and found out that health workers are the most trustful source of information. They trust health workers, but sometimes health workers influence hesitancy. Because sometimes health workers are not vaccinating their children. Sometimes they are not providing the appropriate information. Sometimes they question quality of vaccine. That in our region, for instance, a lot of population question vaccines produced in India. So sometimes even health professionals are influence hesitancy. That's why it's very important to work with health professionals. And UNICEF developed interpersonal communication because I have seen there are some agencies, some associations working already with health professionals on interpersonal communication for immunization. UNICEF also developed a model, and we are going to work to influence their health workers' knowledge and skills to communicate and convince the parents to vaccinate their children. But we have opportunities as well. Sorry. We have new vaccines, meaning that many children can be protected. Yeah? We have new manufacturers that will produce and will have less shortage of vaccines because we'll have more manufacturers. We have new technologies that for supply chain, and we have tools to work with demand bottlenecks. From polio, we can learn a lot because there are a lot of lessons learned, and we can use for future work. Thank you. Universal health coverage commitment. Immunization is a part of primary health care, is one of important element of primary health care and ultimately universal health care. If we can reach child with immunization, we can reach a child with any kind of services. Many countries are growing up and develop economically. We have a lot of strategies and roadmaps on immunization with very clear targets and very clear direction and strategies. So now Gavi is developing the new strategy. Global Vaccine Action Plan is now under the next version is under development. So we have and we know what to do. And of course, we have a huge partnership working in immunization. We start Gavi, WHO, UNICEF, CDCs, Sabin Vaccine Institute, a huge platform of partnership that are working in immunization. And we have SDGs commitment, and not we, but all states or government countries have. But immunization is linked with 14 out of 17 SDGs. If you look carefully, it's influenced majority of SDGs. I will not go through all this. Yeah? And we know that immunization is the biggest return of investment among other any kind of public health or other social investment. What should be UNICEF considered a strategic approach for way forward? Advocate for the realization of the child rights. Immunization is one of the rights of children. And government should be accountable, not only government, everyone. We have to strengthen health and community systems to increase and maintain immunization, high immunization coverage. Even it's more difficult to maintain. In our region and in other regions, many countries didn't manage to maintain high coverage and declining the coverage in last years. Also position immunization as a driver for equitable delivery of integrated multi-sectoral services. As I mentioned, UNICEF considers immunization as an equity tracker. If immunization can reach the child, meaning that all kinds of services can reach the child. Sometimes it's important to have other cross-sectoral interventions to reach the children, because sometimes we have to work with social protection, with the education system, with local authorities to reach the children. As I mentioned, there are different immunization strategies and roadmap. UNICEF has developed an approved immunization roadmap for 2018-2030, and aiming at supporting countries to increase immunization coverage and protect children. And this roadmap should be taken into consideration context of the country. And many components can be applied for different countries' context. For high capacity countries, more looking at the demand side, and for fragile emergencies and low capacities, to support development of evidence-based policies, national approaches, but also looking at financing. Sometimes immunization program, they have money only to procure vaccines, but not to for capacity building, for demand creation, for monitoring. I will talk a little bit, I would like to mention about the importance of strengthening health system, because only strong health system can ensure that vaccines reach the children, the community and the children. Only strong health system can ensure health and well-being of children and other population. I'm speaking about children because I'm from UNICEF. But what does it mean? Strengthening health system means that we have to have strong leadership and governance. I mentioned that we have weak political commitment in many countries, not proper evidence-based planning and decision-making. Then we don't have, many countries, they don't have an information system and tracker system that we know where those unvaccinated. Supply chain and procurement capacity building, there is a need to improve forecasting and planning, but also looking at procurement system, registration of vaccine, of all this chain of supply from the procurement until the last mile, when the vaccine reach the health facility children. Building capacity of health workers, not only on immunization in practice, on poor immunization act, but also how to communicate. Many curricula, they don't have communication in their program, so it's important to train health workers how to communicate. And we are working also with curriculum, postgraduate curricula. Surveillance is important. And strengthening the emergency response. Many countries having measles outbreak, they were not ready to respond to the outbreak. So this capacity is also needed. And strengthening health sector and community engagement for demand for immunization. There is a need. The health sector, they don't have this budget line in demand because they always donors were supporting for some campaign, but campaigns are not sustainable. We have to have demand creation as part of health system. And supply and demand should work together. Sometimes, and we have such experience when parents went to health facility and there were no vaccines, they will not come again. So it's very important to balance this and work together as a supply and demand. And quality of service is very important because first, if the first experience was not good, parents will not come again. So in conclusion, there is a comprehensive approach to, there is no only one single approach that can influence strengthen immunization program and improve immunization coverage. Ownership of political commitment is a key of success. Immunization is not a separate, but it's part of a broader package of health services. Local context matter because action should be tailored to the needs and to better understanding, to do a diagnosis, to understand first, and then act based on the evidence. Partnership should be based on comparative advantage and complement each other rather than duplicate it. And immunization program cannot be taken for granted. It needs continuous support and investment. Thank you.